Dr. Samantha Leistman, the pharmacist with Highland Family Medicine, is back with us. Great to have you back in studio.
Hi, good to see you.
Our topic is pharmacists as immunizers. We've talked a little bit about this recently. Let's take a bit of a deeper dive. Let's begin by acknowledging October is National Pharmacy Month. And pharmacists work in lots of different settings. Let's begin right there. Where can we find pharmacists?
So pharmacists do work in a lot of different settings. The most widely recognized is the community setting, so at places like Walgreens, Wegmans, CVS. Pharmacists also work in the hospital. They both work to dispense prescriptions, and they also work on the individual floors with the doctors and other healthcare team members to ensure safe medication use. The setting I work in is actually at an ambulatory care clinic where we see patients that have chronic disease states, and we help to manage those and be a resource for the providers. And then there's also a lot of other places pharmacists work, such as long-term care facilities, at academic institutions, and then also for insurance companies.
You're busy, that's
Yes.
for sure. And you play an important role that people often overlook as someone that can administer a vaccine, right? Let's talk a little bit about maybe some of the types of vaccines that you're able to administer.
Yeah, in New York State, we can administer 5 vaccines. So for flu, herpes zoster, tetanus, meningococcal, and then also pneumonia. To be able to immunize in New York State, pharmacists have to take a course where they have both didactic lecture and then also hands-on learning to ensure that they can administer vaccines safely and correctly. Since 2017, pharmacists can actually immunize patients of all ages, including children. And most pharmacies will immunize on a walk-in basis, especially during flu season.
All right, and here's an important question along those lines. If I want to walk in and get a vaccine, get a flu shot, something like that, especially this time of year, do I have to have a prescription to make that happen?
Under New York State law, you do not need a prescription to receive any of the 5 vaccines at the pharmacy. So when you go in, the pharmacist will review your medical history as well as any medications that you're taking, and then be able to decide what vaccines are appropriate for you. Also, any vaccines that you receive at a pharmacy, that information will be shared with your doctor. There's very few reasons that you could not get a vaccine, but it's important to share your medical conditions and medical history with your pharmacist or doctor so that they can ensure that you get what's safe for you.
Let's finish up with sort of an affirming thought here. Why is it important to get these vaccines? Why is it important to get these vaccines, if I was not clear initially there?
Absolutely. So a lot of people think that because they're healthy or they haven't gotten sick in the past that it's not important for them to get their vaccines, especially for illnesses such as flu or pneumonia. But unfortunately, thousands of people actually die every year because of these vaccine-preventable diseases. And although you may not feel sick or you might not die from the flu, other people, such as the elderly, children, and people that have weak immune systems, could actually be seriously affected by these illnesses.
We will leave it there.
Yeah.
Thank you.
Yeah, good to see you.
Good to see you as well. If you missed any of our conversation, we're sharing it online as always. Just head to rochesterfirst.com.